Hi, I'm Dr. Scott Seymour.
And I'm Dr. Joy Ragu from RBK Pediatric and Urgent Care, coming to you today with some RBK anticipatory guidance and safety videos.
So once again, welcome back to RBK with your 18-month-old. We just wanted to take some time to discuss what to expect at the visit and some of the more important things that we like to talk about with the kids. At 18 months old, the focus is more on the developmental and the behavioral aspects of the kiddos. They're getting older now, and they're walking around, they're running around, they're climbing on things, they're starting to talk a lot more, and they're starting to push the limits of what they have been capable of previously. So we can start to do more with them. Things like toilet training is perfectly acceptable to start at this age. When we talk about toilet training, though, remember, the only way kids know what's normal and what's expected is what we do with them. So what we found the best way to do the toilet training is a very positive system. What we don't want to do with toilet training is yell at kids. We don't want to give them complexes about the poop that would give them stress or anxiety about the toilet. So the best advice here is you get a tiny little potty and you put it somewhere in the house, somewhere non-threatening, somewhere they like to be, somewhere comfortable. And you pick just a couple of times during the day. And at those times, both you and your child, you just go over to the potty and you sit them on it. You can do anything you want to on there. You read a book, you sing a song, you can watch the tablet. You want to make it as fun and as relaxing and as comfortable as possible. And you sit them there for about 15 minutes. During that 15 minutes, if they just so happen to pee or poop into the potty, you make a huge fuss about it. You throw them a party like they just cured cancer or something. You make them feel like $1 million. Doing that encourages them. It makes them feel good about it and lets them know that's what you want them to do. If after the 15 minutes they don't pee, they don't poop, that's okay. You just pick them up and potty time is done. They can go off and do whatever else it is they want to do. No muss, no fuss, no explaining things, nothing. Nice and easy. With kids, it's all about repetition. So you just have to keep doing it over and over and over every single day, the same times on the same potty in the same place, the same amount of time. Eventually, the kiddo will start putting 2 and 2 together and they'll start telling you when it's time to go. And that is when you know you're successful.
Now, your child's behavior is another thing that we talk about at this visit. We have to set limits with the children as to what's important to the parent. And you have to, like you said earlier, be consistent with your child. And when they do good things, you have to praise that for behaving well. And when they do bad things, a little bit of time out. You have to get the child to learn to play with things that the child likes. And, tell them to do things in a nice way. Don't ever scold them or yell at them. And, have the child try to play with toys, actual toys, and let them focus on how to play with them and interact and use these appropriate toys. And expect the children when they're faced with new situations, expect them to be more clingy to you. Now, the language development is very, very important at this age because we need to read to these children and sing to them and talk to them and help them to develop their language because they're not born with a vocabulary in their head. It has to be developed. And the way to do that is to read to the children, use pictures to describe things, use simple words, try to use words to help the child to express its feelings. You can ask the child simple questions and have them confirm the answers. And the words should be clear for your child to understand what the child needs to do. And all this helps with the language development.
Mm-hmm.
Child safety. What about safety, Dr. Scott?
Yeah, so the kiddos, they're getting up, they're moving around, they can run away from you in the blink of an eye. Safety is very, very important at this age. So again, we speak about the car seats all the time. Cars are very, very dangerous. It's always important. We're making sure we're using the rear-facing car seat. We've got the baby in the back. We don't want any injuries with airbags or anything like that. With the car seats, the common question we get is when do we move the kiddos when do we upgrade to bigger sizes and when do we take them out of the car seats? Unfortunately, nowadays, all of the different car seats made by different manufacturers are designed for different weights and ages. So the official recommendation from the American Academy of Pediatrics is to advise you to look at the owner's manual for your specific car seat for that specific information. Remember, these kiddos are great at climbing up on things, grabbing things. You have no idea how they got up there and did it, but make sure all of the dangerous things that they can eat, drink, medicines, detergents, dishwashers, all of the small, tiny objects they can put in their mouths and choke on, paint chips with lead, sharp objects, nails, stuff like that. Make sure all of that stuff is up and off the ground. Move the furniture away from windows or anything else the kiddos can climb even higher up from and fall from even higher down onto. Safety, obviously, with guns, make sure any guns or weapons that we have in the house are safely locked away. Make sure ammunition is stored in a different locked container than the weapons are. Hot things, burns, stoves, kitchens, things like that are very dangerous for the kiddos who are just reaching up and grabbing everything. Just make sure that you take a safety pass on everything and baby-proof the house there for yourself.
Remember, baby child-proofing is not proofing. It's just slowing them down. These children will get into trouble.
Definitely true.
Yeah. Now, I guess creating a family with your child and your family, try to do things together. This helps to develop the child's interactions with the family. A toddler will never share with another child. You should also try to teach a child if they bite children or hurt other children or pets, tell them that's no good. And then this is the age when they start to be a little bit more independent, but clinging is normal for these children. You should spend as much time with the child as possible. Don't use the devices to occupy the child. That is not good. And always try to get the child to eat new foods. Now, vaccines are given at this age also.
So vaccinations at this age, a lot of the times the kiddos are caught up at vaccinations at this particular visit. So typically we do not have to give too many vaccines. So if you remember back to your 10-month visit, we arrange our vaccination schedule at RBK so that when we do the little finger prick that's mandated by New York State to check for iron and lead levels, we give the kids a little bit of a rest on the shots too. So if the kiddos need any extra shots and need to catch up on anything, we will do those. But we will also do that finger prick and check for a reflection of the iron level and the lead level as well.
Yeah, by 18 months, we do have that DTP booster that we have to give, number 4. So we'll do that to prevent whooping cough. So these are some of the illnesses that we used to see way back in the day. Diphtheria with the thick, leathery mucous membrane that develops, or tetanus in the middle, or a whooping cough we still see today. Unfortunately, it's not as severe as it used to be, and the big kids have a 100-day cough, and the little kids get into trouble. So the end result of all these illnesses in the past were hospitalizations and critical care medicine, but because of the good job we do with the vaccines, we basically cured or prevented all these childhood illnesses.
Remember, vaccines are safe and they are effective. If you have any questions or concerns about any of the vaccines that we're going to be giving your child, please feel free to ask us. We are more than happy to discuss all of this with you.
Okay, so this is Dr. Rogu, George Rogu, signing off. And
I'm Dr. Scott Sainamore. Thank you guys for spending a little bit more time with us. Hopefully you learned something. Please feel free to ask us any questions that you have when you come in for the appointment. We're looking forward to seeing you.